Vanessa Clark, BBC News, Knowsley.
Well, we can talk now to the Chief Executive at the Royal College of Speech and Language Therapists, Kamini Gadhok. Welcome. Thank you very much for joining us. How concerned are you by this?
Well, we've been raising our concerns to government for some time now as we've been undertaking surveys of our members who've been telling us about the increase in referrals of children. And it's unprecedented, I think, and certainly it's been now borne out by government data that shows that, for example, children at 2.5 years of age are not meeting the expected standard of communication through health visitor screening assessments. So we have been raising concerns both about the number of children who are being referred, as well as the severity of the communication needs that they have. Along with that, we've had those children who couldn't access speech language therapy during the lockdowns, and so some of their needs have also got worse.
So there are two issues then. There are children that would have needed speech language therapy anyway, but there are also kids who just haven't picked up all of the verbal skills that they would have normally done as a result of being locked down at home and not having that extra socialisation. That's right.
So we've got a situation where those children who didn't get an opportunity to socialise have got more significant speech and language communication needs, and you would normally not see the numbers that are now being reported. And in terms of the waiting list, we understand they've gone up over 65,000 for children waiting to be seen by a speech and language therapist. During the lockdowns period, we did raise concerns about speech therapists being redeployed to other services and not being able to do even offer what we helped to set up for the profession, which is using digital health and digital technology to support access to services during that period of time. However, not all families can access digital services because many are living in digital poverty. So we've still got this backlog of children, as you said, who were in the system, as well as the children who are now coming up and needing support.
And when we hear about the impact on the children, we were hearing about the impact on Seamus, his mother, describing the frustration that he felt. Communication obviously is vital, and for these kids who found themselves unable to communicate what they wanted to, does that have a longer term impact?
Absolutely. So we know that the importance of children learning to communicate at an early age actually affects their learning and their development and their socialisation. It also affects their mental health and their behaviour. So it's really important that we think about this not just around sort of early language and communication for socialisation to make friends, but also in terms of learning. So we know that for children who've got poor language at age of 5, they're 6 times less likely to reach the expected standard of English at the age of 11. In terms of mental health, which we know there's a big focus around mental health, that young people who are referred to mental health services are 3 times more likely to have communication needs. And similarly with behaviour, over 80% of children with emotional and behavioural difficulties have communication needs. So it's really important that we identify and support these children early on. I think we all, forget how important it is to communicate, as we've said, not just to socialise and make friends, but to learn and to access educational opportunities.
That's a really interesting point that you just made there about children with mental health difficulties at a later stage often have communication issues. Do you have a view on which one comes first? I mean, they're obviously wrapped up together.
They are, but if you can imagine, if you're struggling to communicate your needs and to make friends, that it will inevitably affect your well-being. So it's very much a foundational skill to be able to communicate, and it is a door to everything we do as human beings. Whether, as I said, it's to make friends, to be able to communicate with your family, to access your home language, your culture, and your community, or to learn. So inevitably, it affects your mental health and well-being. And if you're not able to make friends, that's another huge impact for children if they can't make friends and if they're bullied at school because they can't communicate or be understood.
Thank you very much for joining us. Kamini Gadhok, Chief Executive at the Royal College of Speech and Language Therapists.